everyone, this is Dr. Jonathan at Kalkstein Chiropractic, your Baltimore area chiropractor. Today we have Ryan. He is a lacrosse player at Stevenson. You're a senior?
Yes, I'm a senior.
Awesome. And he plays defense, correct? The long
That's right. Yes,
awesome.
that is right.
So he is a collegiate athlete. He gets chiropractic care for just feeling optimally his best physically, having his nervous system fire right. And so what we do with them, we dry needle, we adjust, and then we'll do some soft tissue work as well. So furthermore, let's get started. So have on your back for me, please, face up. How's your week going?
It's going good. Got a lot of homework to do, catching up on a little bit of stuff, but it's pretty good.
And season is in the spring for you, correct?
Yes, that's correct.
Even off season, he's doing a lot of things for him. Keeping in shape, staying conditioned, and then just coming in about once a week, once every other week for some adjustments and tune-ups. He moves pretty well, sometimes almost too well, where he doesn't need some adjustments. We're gonna give a show for you guys. So right now I'm just palpating his cervical spine. I'm at C2, C3, 4, a little stuck there, and then CT right there. We're gonna get this guy first. Nice and loose. Let that fall. If we had a mic on, I don't know, maybe this mic picked it up.
It's pretty loud to me.
Oh yeah, the loudest. Loose. How long have you been playing lacrosse?
Since kindergarten.
Kindergarten?
Yeah, for a long time.
You started that young?
Yeah, my dad put a stick in my hand pretty much as soon as I could walk. So,
I love that.
yeah.
I think the hardest thing when I tried, at least just using the stick, was the cradle.
Yeah, it's some people get it, some people it's a little harder.
It's extremely hard. Like, we're running like this, I don't know. Keeping the ball in the little net. Little crepitus. Good. Nice. I'm gonna get his hips nice and loose. I usually ask my patients how tall they want to be, but he's already kind of a giant, so. And then this is his favorite side right here.
That was a good one.
Yes, sir. And let's get you on your side facing me. Traction this down. Pretty good. Might be one or two. Here, 5S1. Big breath. Let this roll. Loose, loose, loose. There we go. And then after this, we'll take a little break and then pick back up for the needles. I'll show you all the points we needle, because at the end of the day, Ryan looks like a porcupine. Loose. Alright, we're back with Ryan. Just adjusted Ryan. Now we're doing the dry needle part. And pretty much the same areas that we adjusted, we're gonna also needle. Don't worry, your back is getting broke. So I like to work top to bottom, and knowing the anatomy structures, finding the spinous processes to get that interspinous ligament. And a lot of times people ask, do needles hurt? And sometimes they can with some of the insertions, but one, usually when that does happen, we're usually targeting the right tissues, and two, kind of turns into like a weird pressure afterwards. Would you agree with that, Ryan?
Yeah, I agree with that statement.
Ryan's been with us since last February, almost a whole year now. I think at this point, he's probably used to some needles. And when does the season start for you?
Practice start January, game start February.
Man, it's coming up.
I know. It's soon but far away at the same time.
Yeah. Well, senior year, man, you're gonna crush it. That's the other thing that like people don't realize when people come into your office. Most of the time they're in pain. However, sometimes we get people that are really active and move really well in general, might not have a lot of ailments or pain to report, but they know the benefits of getting chiropractic care with physical therapy too. So Ryan's just getting ahead of the game in terms of like making sure that his tissues are working right, firing in the right order, and just movements is going to be a lot cleaner. That's why we're doing this.
Injury in some cases to protect underlying structures, so we're trying to release some of that tension, especially before getting you back to Dr. Dave. Makes the adjustment a little easier as well. Okay. So I'm going to put these pads on you. Actually, I should have asked you that.
So with traps that we get right here, we got to make sure we pull the muscle away from the lung field because the apex or the top of the lung is so closely related to that muscle that if we have to drag that tissue away from that to make sure we're not going to puncture his lungs. You doing okay, Ryan?
Okay.
So I'm now palpating for his teres minor and major. I found it. Oh yeah.
You may take a second to actually see through the towel there, but we're feeling the warmth soon. So Michael, what we're looking for here is what we call a strong level of stimulus, so you should feel it. It shouldn't feel so strong that you're having to fight back.
Katy Perry
To
fan.
protect yourself. And shouldn't feel so lightheaded, essentially. So you're kind of
I haven't
seeing
seen her do anything lately.
slowly.
I know she's a judge on American Idol.
Beginning to feel some of those.
Alright, so now I'm going to work down into his low back. So, landmarks, find that 12th rib. I know I'm going to be in the T12 L1 area. And then I'll just palpate down. Now I know I'm on L3.
Your only job is to hang out for the next.
So if you see the little technique that we're doing by inserting it, and then I'll show you with the sand. Twisting the needle, what that does is, other than give Ryan a little bit more stimulus in that, we're getting fascia kind of twirled around this needle, and there's a lot of literature that shows that fascia is still a contractible tissue, and then can be very therapeutic when it kind of winds around that needle to furthermore encourage the remodeling of these tissues, because dry needle is a destructive modality to these tissues purposely so we can get the healing process started. Fresh blood with better nutrients are going to be brought to the area, as well as just that time to remodel these tissues to function a lot better. So I like to kind of make the analogy where people work out and they break down those fibers and then they regrow stronger. It's kind of the same proliferation with these tissues here with the needles, but we're not doing the actual workout themselves. But when the new tissues lay down, they should be able to glide better. So sometimes tissues adhere to each other and it won't glide or function, either with just normal adherence to the tissues or trauma will be substituted with scar tissue. But essentially the needle will just help calm and inhibit those muscles and then give it time to remodel to function a little bit better. With better function, usually pain will follow, and that's one of the things that we are big advocates for. We're always trying to improve patients' function, because if function is better, usually pain is going to be less. Doing okay, Ryan? Awesome. Got a few more. Dose more. And the last one. Alright, you good, Ryan?
Doing good.
Awesome. So that is a treatment for today's patient, Ryan, a collegiate lacrosse player. Likes to get tuned up, likes to be optically moving at its best, at his best. And we'll see you guys next time.
Chiropractic.